How am I going to diagnose COPD? And you are going to look at chronic conditions. So if you go into the objectives, look out for chronic conditions like diabetes, congestive heart failure, COPD, chronic kidney disease, hypertension. These are all objectives that you need to study. So what are you going to study so far as this particular box is concerned? You're going to study diagnostic criteria and staging of chronic conditions. How am I going to diagnose COPD? How am I going to diagnose congestive heart failure? How am I going to diagnose diabetes? What's the gold standard for COPD diagnosis? What's the gold standard for CKD? And then what are the stages of CKD? Stage 1, stage 2, all those things. And then as well as if you have a patient with a chronic medical condition, what investigations will you do to monitor that patient week in, week out, month in, month out, year in, year out? As well as you also want to learn how to detect complications of medical conditions. So if you pick a condition like diabetes, you're going to learn, how does diabetic neuropathy present? How does diabetic nephropathy present? So if I'm taking the test, what will be my tactic? Know when to refer a patient and when to let the patient be managed by a primary care physician, as well as how to link diagnosis to long-term care outcomes.